I'm Nima Rajan, and this is Forum Daily Week in Review. The Ontario Medical Association says about 400,000 fewer mammograms were performed during the pandemic than originally anticipated. Now, although screenings have now returned to normal levels, the organization is warning that the temporary decrease in testing has led to cases of breast cancer that were further along when diagnosed. The association says survival rates of women with breast cancer decline if the detection of the disease is delayed. Well, with us now to discuss mammograms and the importance of detection is Dr. Abhishek Rout, Medical Director at Appletree Medical Group. Dr. Rout, welcome back to Forum Daily.
Great to be here today.
So, medically speaking, just how significant of a warning is this from the Ontario Medical Association?
Well, I think it's fairly significant. If we look at breast cancer, it's one of the most common cancers amongst Canadian women, excluding non-melanoma skin cancers. It's the second leading cause of death from cancer in Canadian women. So we know that mammograms have really helped reduce breast cancer mortality. We've had several studies that show that it's reduced mortality by almost 40% since 1990. So that's a big number there. One study showed that mammography screening cuts the risk of dying by nearly in half. And in the United States, where a lot of these studies were done, that translated to about 432,000 breast cancer deaths that were prevented because of mammograms.
So, what kind of data do we have around the causes of breast cancer? Is it purely genetic, Dr. Rout?
I think that's a very good question. What we do find is there are genetic factors in there, and there are risks that we can't change. Getting older, genetic mutations like BRCA and BRCA2, reproductive history or having denser breasts can also cause increased risk. And of course, family histories there of cancers. But there are risks we can change. So not being physically active, being overweight or having high obesity after menopause, taking hormonal medications, a reproductive history, so having a first pregnancy after the age of 30, or drinking alcohol, all can modify the risks. And certainly there are factors like this that affect risk in general.
It's good to know there are prevention factors, doctor. Now, we hear a lot about checking for lumps in the breast, but are there any other symptoms that women should be aware of when it comes to breast cancer?
Right. So what we typically notice is that sometimes someone will notice a new lump in the breast or underarm, perhaps even a thickening or swelling. Sometimes you'll see irritation on the skin, redness or flaky skin around the area as well. Sometimes there is nipple discharge or change in the size or shape of the breast. And finally, any pain in the area. So when we have these symptoms, there's certainly causes for concern. They could be conditions outside of cancer, but it's certainly worth investigating when you have these symptoms here.
Now, on that point, considering there are some ways to check for lumps and other symptoms at home or with a partner, when do mammograms become necessary, Dr. Rout?
Right. So the concern is breast cancer can be quite asymptomatic as well, meaning you absolutely have no symptoms and still have breast cancer. So mammograms are helpful tests that are designed to screen asymptomatic individuals. And if you are at particular high risk because of the factors we had mentioned above, that's where mammograms work quite well to capture those as well. And that's why they're so essential and part of our arsenal for against breast cancer.
All right, Dr. Rout, what are some other types of cancers that Canadians can and should get checked for?
Right. So lung cancer is the most commonly diagnosed cancer and the leading cause of death in Canada. So if someone was a smoker, had a 20-year pack history of smoking, it's very important that they contact their doctor to screen for lung cancer. Colorectal cancers are the third most common cancer in Canada. The FIT screening stool tests are available and can actually be done at home. So you can mail out back to the lab there. Prostate cancer is the most common cancer for Canadian men. Prostate screening includes typically a digital rectal exam as well as a prostate blood test there. And then finally, cervical cancers, which can be screened by pap testing as well.
All right, Dr. Rout, a quick minute left here, but any advice for people who may be wary visiting hospitals and doctors for these checkups, especially following the pandemic?
All right, I definitely understand and empathize with that reluctance. I think we've seen wave after wave of COVID-19, and then we've had a few other issues we'd have to deal with as well. So people are understandably afraid, but certainly I think it's very important to get those screenings and checkups done. Keeping in mind these screenings for cancers save lives. So please talk to your doctor about these screening tests that you can do for your health.
Always an important conversation. Dr. Rout, thank you again for your time today.
Thanks so much for having me.
After the break, we're going to be taking a look at the situation facing young girls around the world. We'll have our interview with UN Women's Deputy Executive Director, Anita Bhatia. She'll unpack the significance of the International Day of the Girl Child, the challenges facing young girls around the world, and what her organization is looking for from policymakers. Today marks the 10th anniversary of the International Day of the Girl Child. The UN General Assembly adopted a resolution to recognize the day in 2011. It was to highlight the rights and the unique challenges that girls face around the world. This year's UN theme is Our Time is Now, Our Rights, Our Future. While the UN notes that progress has been made on issues that matter to girls, there are continued challenges. These include the COVID-19 pandemic, humanitarian conflicts, and climate change. Well, with us now to discuss this is Ms. Anita Bhatia, a Deputy Executive Director for UN Women. Ms. Bhatia, welcome back to Forum Daily.
Good to be with you.
Great to have you back, ma'am. Now, as we mentioned, today is the 10th anniversary of the International Day of the Girl Child. So has there been any progress made since its inception in 2011?
I think we have seen progress on a number of important fronts. For example, access to education by girls, changes in the rate of female genital mutilation, which really affects girls in certain parts of the world, declines in child marriage, declines in the rate of HIV/AIDS for girls. We have seen progress on a number of these fronts. Well, what has happened is that the pandemic actually changed the trajectory of the change for a number of girls. So areas where girls were progressing took a big hit during the pandemic, for example, girls' education. And now the rate of learning poverty among girls is again very high.
That's really interesting how the pandemic has impacted this progress, ma'am. Now, in terms of one of the biggest women's rights movements in the world happening right now, we could see that in Iran, where women are protesting following the death of 22-year-old Mahsa Amini in the hands of morality police. So what is a UN Women's stance on the protests being held in that country?
Well, first of all, we believe in the right to peaceful protest, and we have issued a statement strongly affirming that we believe that people all over the world have the right to protest. And we have asked that they be allowed to protest peacefully without fear of violence and without fear of reprisal. This is something that is very concerning to us because we stand for human rights, and any situation where there is an abuse of human rights or violation of human rights is of concern to us.
And unfortunately, Iran isn't the only country that has implemented such dangerous and oppressive systems for women and girls in their country. So just how prominent of an issue is this internationally, Ms. Bhatia?
I think this is a very big issue today. If you look at Afghanistan and what is happening there, where girls are still denied very fundamental rights like the right to an education and the right to go to school, you would have to look around the world today and say things are much worse for girls today than they were just a few years ago.
And even without any oppressive regimes, we know girls continue to face inequalities around the world. So in what other ways are girls being kept back from their progress?
Well, I think the whole issue first of learning poverty that occurred during the pandemic is really, really important. And it is very important for public policy makers to focus on getting girls back to school and to make sure that they're able to make up for the gap of the last few years. The second thing is something like child marriage, which affects girls in many different parts of the world, is something that we really have to attack with a sense of urgency. So while it's true that about 10 years ago, you had about 1 in 4 girls getting married really young, and today that number is about 1 in 5, it really needs to be 0 because child marriage is a form of violence against girls. So, this is something that because policymakers are so busy dealing with inflation, the war, the breakdown of supply chains, the rise in interest rates, the bandwidth and the space for dealing with these issues simply isn't there. But this is what the future of the world depends on, making sure that girls get back into school, children get back into school, and that these kinds of age-old practices like child marriage, come to an end once and for all.
Definitely, ma'am. Now, we've got a quick 30 seconds left here, but what would you say is the main takeaway you would want our viewers and even officials watching this to take away from this interview?
International Day of the Girls isn't just for talk. It is really for translating policy commitments that governments have made into action. This is an urgent agenda, and we need to be worrying about this because girls are our future. Children are our future. So if we don't focus on making sure that those who are holding the world in their hands are actually in a position to be fully enjoying their rights, then I think we are really facing the prospect of a very perilous planet.
All right, Ms. Bhatia, some very moving words there. Thank you again for your time today.
Pleasure to be with you. Thank you.
Although inflation and interest rate hikes continue to dog people in the United States and Canada, the US dollar remains strong. But it's a different story for its Canadian counterpart. The Canadian dollar has weakened to its lowest level in over 2 years against the US dollar. Today's consumer price report in the US indicates that the country's central bank will keep raising interest rates aggressively. And this is worrying investors that the aggressive tightening could lead to a recession and add even more pressure on the loonie. Meanwhile, these rate hikes by the Federal Reserve will likely only bolster the US dollar. Well, joining us now to help us make sense of it all is Brendan Caldwell, Director of Caldwell Securities Limited. Brendan, welcome back.
Thank you, Nima.
Now, the US dollar is commonly called the king dollar, Brendan, and it's quite the fitting name these days. So why is the US dollar so strong?
Well, I don't know if it's always been king, but the U.S. Federal Reserve has been very aggressive in raising interest rates, and more aggressive than Canada, more aggressive than other countries around the world. The idea in classical economic theory is if you raise interest rates as a central bank, by which I mean, in the case of the US, the Fed funds rate, or the rate at which the central bank, the government-run bank, lends to all the other banks, all the commercial banks, the ones you've heard of, like Bank of America or Citigroup or these. So as they raise that rate, all the other interest rates, particularly short-term rates, go up in concert. And they're trying to raise rates, again, according to classical economic theory, to slow down the economy, to make it more difficult for people to access money, borrow for either expenditures or investments. They're just trying to slow the economy down. And if you raise your rates as a country faster than the other guy raises his rates, people are going to want to buy your currency because they can get more on their money in a bank account or a treasury bill or other short-term deposit in your country's denomination. So higher rates tends to lead to a much stronger currency, and the US being the most aggressive in the world, as well as being the, you say, king dollar, it's the world reserve currency. So it has that going for it as well. So everybody is around the world is scrambling to buy US dollars at the expense of the loonie and other currencies.
Now, at the same time, we know many commodities are priced in US dollars. So how does that affect people or the countries that need to buy these commodities, Brendan?
Oh, well, yeah. So other countries kind of get a double whammy. So here in Canada, we're talking 7-8% inflation. The US, something similar, because our dollar has declined, but only a little bit. I mean, a few cents relative to the US dollar. I mean, big in currency terms, but not in global terms. But if you're, say, in Turkey, where the official inflation rate is north of 80%, and the unofficial rate's probably like 180%, and people don't make more than $10,000 a year on average, when the price of these global commodities like energy go up, I mean, basic stuff to make things like copper or anything that's denominated in US dollars, as the price of the US dollar goes up against your currency, the price of everything else that uses energy or food or other raw materials goes up even more. So it exacerbates the inflation issue that other countries are experiencing. So it's maybe a way to slow down the US economy and keep inflation in the US under control. It's actually perhaps making it worse, particularly in developing countries.
Now, in terms of developed countries, we know the UK is in a similar situation with the pound fluctuating against the US dollar, and the UK is trying to tackle this issue. So can you tell us a little bit more about their plan?
Well, I don't know if they have a plan so much as a series of reactions. you didn't think they'd miss their Prime Minister, Boris Johnson, quite so quickly, because by the time he was gone, everybody wanted him to be gone. But the new Prime Minister there had a plan to subsidize energy costs for the average Briton. Well, that was going to cost some vast billions and billions. It sounded like Carl Sagan, billions and billions of pounds. And so the worldwide investors in bonds and currencies thought, oh, the British are going to have to raise billions and billions in new financing. So they hit the pound very hard. UK interest rates have gone up considerably. It doesn't seem to be a situation where they have so much as a plan as a series of reactions, and the British government has reversed itself at least once or twice just in the past week or so. So not just developing countries, but developed countries like the United Kingdom, they've had a pretty tough month with one thing and another.
Always lots to keep our eyes out for. Brendan Caldwell, again, thank you so much for joining us today on Forum Daily.
Thank you, Nima.
All right, up next, a look at the fight for sex work law reform across Canada. We'll have our interview with Ms. Jen Clayman from the Canadian Alliance for Sex Work Law Reform right after the break. Stay tuned. A landmark case brought before Ontario Superior Court is challenging Canada's laws around sex work. The Canadian Alliance for Sex Work Law Reform and several individuals are arguing that the current laws violate provisions of the Charter of Rights and Freedoms, which in turn forces sex workers into unsafe conditions. The groups are asking that several sections of the Criminal Code be deemed unconstitutional. These sections criminalize advertising sexual services and communicating to buy or sell sexual services. Jen Clayman with the Canadian Alliance for Sex Work Law Reform says there shouldn't be any criminal laws that are specific to sex work. Ms. Clayman joins us now to give us the latest updates in this case. Ma'am, welcome to Forum Daily.
Thanks for having us.
Now, 5 days of arguments for this case came to a close on Friday. So what were the main takeaways from last week's hearing in Ontario Superior Court, and what are the latest updates in this case?
It was a week full of energy from community. There were a lot of sex workers who showed up from across the country and locally to watch the case. A lot of people have really high stakes in the case. Over the past 7 years, sex workers' rights have been violated because of the new laws that were implemented in 2014. For sex workers in the case, it's really important that these violations are recognized and that their experiences of the laws are placed at the center of the discussion, and that we need to listen to those experiences.
Now, your group is arguing that the criminalization of sex work in Canada is, as you said, taking away the rights of sex workers and forcing them into unsafe conditions. So what does that look like through the lens of a sex worker in Canada?
Sex workers, because of the current laws, are forced to work in a context of criminalization. And what that means is that at any moment, and in all moments, sex workers and clients and third parties, the people who work with or for sex workers, are all avoiding detection from law enforcement. And what that means is that sex workers are forced into isolation. And though some people don't recognize, but when you're in isolation, it means you have a lack of access to supports should you need them. It means sex workers are not able to meaningfully communicate consent with clients because doing so is illegal. Sex workers are limited, if not prevented, from accessing health and social and legal services. And so the total context of criminalization actually puts sex workers in a context where they cannot access the means that they need to be able to protect their health and safety.
Can you tell us a little bit more about how these safety concerns of sex workers in Canada are being handled by authorities and police who are in charge of protecting our civilians?
Well, I think people take for granted what it means to be criminalized. And so if you can imagine or understand that when police are mandated to arrest clients, third parties, and some of whom are sex workers as well, everybody's avoiding law enforcement, and it really creates an antagonistic relationship with law enforcement. And so when people need access to law enforcement, should they ever need access to law enforcement, they don't necessarily have that access. And this is even more pronounced for communities that are over-surveilled and underprotected by law enforcement. So Indigenous women on the street, Black women, racialized women, migrant women, trans women, communities that are already over-policed and under-surveilled, who are targeted because of criminalization, because people who are predators know that sex workers won't go to police, and so it puts a target on sex workers' back, and they're unable to contact police as a result of the criminalization.
And we know sex work has been decriminalized in other countries, including New Zealand, a lot of countries in Europe. So what kind of impact has this made on the overall safety and well-being of sex workers there? Just a quick minute and a half left here.
Yeah, it's a huge impact. So in New Zealand, you have a context where sex workers are recognized under labor standards. There's a sex worker recently who went to a human rights tribunal and was awarded $250,000 for a sexual assault in her workplace. That wouldn't have been recognized as sexual assault in a context where all sex workers considered sexual assault. And so a decriminalized context means that sex workers have access to mechanisms to improve their working conditions and to be able to fight for their rights as workers.
All right, Ms. Clayman, a quick 45 seconds left here. I really want to get this question in. So there are concerns around sex trafficking and the sexual exploitation of people. So how might the decriminalization of sex work impact these ongoing issues in our country?
Absolutely. The exploitation is actually the reason that sex workers brought forward this case, is because sex workers want that exploitation and violence in their lives to stop. When you have a criminalized industry, it actually allows exploitation to flourish. And so decriminalization really allows the identification of real violence rather than wasting a lot of resources on the sex industry where there might not be any violence.
All right, Ms. Clayman, thank you again for joining us today on Forum Daily.
Thanks for having me.
All right, I'm Nima Rajan, and that'll do it for your look at important conversations from this past week. Remember, for more news on demand, you could always visit our website, thenewsforum.ca, and make sure to follow us on our social media handles. We're available on Facebook, Instagram, and Twitter for updates. You could also watch all of our news and commentary programming on the News Forum YouTube channel. Thanks for joining us again on the Forum Daily Week in Review, and we'll see you again next time. Take care, Canada, and have a great weekend.